It is devastating when someone is diagnosed with a terminal illness, for the person themselves and those close to them. The team who is caring for them aim to ensure that they receive the best treatment possible according to the patient's own personal goals. The palliative care team works closely with other specialists to support the patients and their families. Our role is to consider the patient's needs as a whole, treating any symptoms they may have, and supporting them emotionally and psychologically. We may be involved from diagnosis, and we support patients with a prognosis of years, months, or weeks, and when they are dying, in the next hours or days. We work alongside the medical and surgical teams and liaise with the community and hospice palliative care teams, the GP and district nurses.
When we speak about palliative care, we're speaking about care that is holistic in nature, given when a cure is impossible, and this includes physical, emotional, and spiritual aspects. And the focus of palliative care is to improve comfort and quality of life, and this is provided by all healthcare professionals and supported by specialist palliative care teams when needed. It's important to remember that palliative care refers to a broad span of prognoses, ranging from hours to years, and that depends on clinical condition of the patient. When we speak of end-of-life care in particular, we are referring to the last year or so of life, and all care given within that time frame.
A lot of people want to die at home because it's a familiar place, often a place where they feel safe, whether that's in a care home or in their own home. And we as GPs work together with the district nursing team, carers and the family to try and enable people to stay at home when they're dying. Often this might involve having equipment being brought into the home, such as a bed, to make it easier for them to be nursed at home. That may mean needing drugs that they can be prescribed and have available at home too.
Patients are admitted here to the inpatient unit at the hospice for a wide range of symptoms for a number of reasons. They come sort of for mainly terminal illness, non-curative illnesses really. We provide a lot of psychological, spiritual care and pain control and symptom control.
As a team, we're passionate at putting the patient at the heart of what we do. We want to get to know them as a person and their families. And although we're the doctors and nurses this morning doing our ward round, we're a very small part of a much bigger team that offers holistic care to our patients.
We often find that in the last days of life there needs to be more GP and district nursing visits to ensure that people remain comfortable and any new symptoms are assessed and managed. And most of the time that can be something we can maintain in the community. Sometimes we also need the assistance of our specialist palliative care colleagues, and that might be a clinical nurse specialist or a doctor that might advise or come and visit in the home.
Myton at Home work very closely with the district nurse, who is the patient's individual district nurse, who is attached to their GP surgery, and we work closely with the palliative care nurses. And in that way we get a very joined up service so that the patient gets the very best care that they can. We provide nursing care and we provide psychological support for the patient and also their families. It's obviously a very hard time for the families, and in order for this to work well at home, the families have to be supported.
We provide an advisory role to GPs and district nurses, supporting their patients at home when needed. We help with symptom management and psychological support for patients in the terminal phase of their lives.
The Castle Register is a secure electronic clinical system which allows staff to communicate effectively with colleagues about patients who are approaching the end of life. With the patient's consent, staff can share the most important clinical information and the patient's personal preferences. This information can be viewed by trained professionals working in the hospital, community and hospice settings. The system is available in hours and out of hours, and relevant information is shared with the ambulance service and NHS 111.